Hello everyone, welcome to Enzyme MBBS, where complex medicine becomes simple and exam ready. Okay, without wasting any time, let's get started. But for a change in this video, instead of going to the definition and all other things first, we'll first understand mechanism, because once you understand the mechanism, then everything else becomes easy. Trust me, everything else will become easy. So let's start with the mechanism first. So before going to directly the mechanism, you need to have a knowledge of few proteins. Okay, so the proteins that are involved in the apoptosis are known as BH proteins. Now under BH proteins, there are a kind of types, like there are anti-apoptotic factors, which basically the name itself suggests they oppose the apoptosis, whereas there are also pro-apoptotic factors which promote the apoptosis. So I have written those names. Of course you have to remember those names, but there is one mnemonic which is, one trick that is used very in a large scale, that is anti-apoptotic means they basically hinder, they do not allow the apoptosis, so they allow the long living of cell. So the long L has in its name, and all these proteins also have L in this name. There is one exception, that is in the pro-apoptotic factor. There is again BSLX5, which have L in the name, but it doesn't have in pro-apoptotic. So that one thing you have to note. And the sensors, they are neither anti nor pro. They basically sense, and then they either stimulate one of these. So that is their role. Now coming to the mechanism. Now here there is one diagram which you may think, oh, this is little complex, but trust me, this is very interesting as well as very easy. Once you will understand, we will understand it. Okay, so now starting with, look at that below, that is DNA damage, protein misfolding, absence of survival signal, and growth factor withdrawal. So all these are basically the stimulus. And apoptosis basically has two pathways. One is intrinsic, one is extrinsic. Now intrinsic, why it is known as intrinsic? Because it is a mitochondrial pathway, and mitochondria is present inside the cell. Whereas the extrinsic, it is basically known as death receptor pathway, because that receptor is present outside of the cell. So that is intrinsic and extrinsic. And then they will follow a common execution pathway, which we will see later. So coming to the intrinsic pathway. Now there will be some stimulations in the cells, or there will be some obviously we'll call it as stimulation. So there will be some stimulations in the cell. They are DNA damage, protein misfolding, or absence of survival signal. There is something called a cell survival signal. If something affects it and it doesn't present, then it also triggers, and growth factor withdrawal. All these will act as a triggers, which is basically sensed by those BH3 sensors. Okay, now BH3 sensors sense it, and they will activate the pro-apoptotic factors that are backs and back. Now pro-apoptotic means they are gonna promote apoptosis. Before that, anti-apoptotic factors were active and they were preventing the apoptosis, but now this backs and back will promote the apoptosis. What they will do, they will form a dimer, and they will form a channel which is gonna leak out some proteins from the mitochondria. Now, what are these proteins from the mitochondria? You may have heard cytochrome C in your electron transport complex, which is very much essential for maintaining the integrity of that cell membrane and plays a very crucial role in the ETC. So now, in order to to for a cell to stay safe, to stay safe, it needs that protein, it needs the cytochrome C. But this backs and back, they form a channel, and through that channel these proteins gets leaked out into the cytoplasm. Okay, now the cytochrome C has entered the cytoplasm, and there are few other pro-apoptotic proteins which are also present in the cytoplasm. They will combine with one more factor which is known as APAF1, which basically means apoptosis activating factor. Okay, so these three combine and they will form a complex called as apoptosome. Okay, so whenever that ome comes, it is basically meaning a complex. Lysosome, it has a complex of enzymes, right? Apoptosome. So apoptosome, it is basically formed by the combination of cytochrome C, other pro-apoptotic proteins, and apoptosis activating factor 1. So apoptosome formation is formed. Now ultimately, so you know that from your basic knowledge that apoptosis basically requires some enzymes called as Caspases. they are very much important, right? Now, all these enzymes will be inactive in the form. So basically, in both intrinsic and extrinsic pathway, we have to activate this enzyme. Now, apoptosis formation, once it takes place, that basically activates one of the caspases called as caspase 9. So here we complete the intrinsic pathway. Now coming to the extrinsic pathway, as I said, it is basically a receptor mediated which is present outside the cell. So there is something called as FAS receptor outside the cell. Now when a virus enters the cell or some stimulus particularly will provide a ligand which will combine with this FAS receptor to form FASL, basically FAS ligand or FASL, which we have written. Now, in the FAS receptor, you could have seen that there is something called as death domain. Okay. Now, what happens is when this FAS ligand comes and bind to the receptor, it results in formation something called as FAS associated death domain. Okay, what it is called? It is called as FAS associated death domain, abbreviated as FADD. Now, what will this do? It will convert, inactive caspase into active caspase. Here it is 8. In the intrinsic it is 9. In the extrinsic it is 8. Because caspase 8 will be in its inactive form known as pro-caspase 8. And a factor called as flip basically keeps the pro-caspase in the inactive form itself. But this FADD or FAS associated death domain converts that pro-caspase into caspase 8. And now we have activated caspase 9 and caspase 8. Both intrinsic and extrinsic pathway have been completed. Now what happens is this caspase 8 and caspase 9, either caspase 8 or caspase 9, because anything can happen. A virus can come and extrinsic pathway can be followed, or this DNA damage can occur and intrinsic pathway can be followed. It's just like your blood clotting, both intrinsic and extrinsic. Anything can happen, right? It is just like that. There also extrinsic is little small. Here is also extrinsic is little small. Come on. Okay. So now you have caspase 8 and caspase 9, which will activate caspase 3 and 6. Okay, now this caspase 3 and 6 will actually do some action. They will fragment the nucleus, which results in nuclear fragmentation, and they will also break down the cytoskeleton in the proteins. So when this happens, there is something called as phosphatidylserine. Okay, there is something called as phosphatidylserine inside a cell, which is basically present inside the cell. But when this nuclear fragmentation happens, cytoskeleton happens, proteins break down, all this happens, the cell membrane or that phospholipid layer itself, it gets inverted. The phosphatidylserine which is present inside will come outside, and all this breakdown of cytoskeleton proteins, all these things will release some few bodies called as apoptotic bodies. Now apoptotic bodies are released and the phosphatidylserine has come outside. So this phosphatidylserine coming outside is sensed by the macrophages. It basically serves as a eat me signal. Okay, now the macrophages comes and it silently eats that apoptotic body. It's like, see, in the necrosis, when the cellular content leaks out, there is, many of contents come, there is inflammation, there is pain, we can sense it. But apoptosis is silent. It is, that's why dangerous, even in the cancers, when the apoptosis begins. You cannot determine in the early stages because of this. The macrophages comes because of that eat me signal and it eats away the apoptotic body. It's that simple. The diagram which you feared in the starting of the video, it's that simple. Yes. And coming to the next process, what happens, which I just described now. See, in the necrosis I said, the inflammation occurs and all those things happens, which you call as phagocytosis, but this is silent. So this has a special name, that's it. It is known as efferocytosis. So it is basically removal of dead cells. So the mechanism, what happens, phosphatidylserine flips to the outer membrane. It serves as a eat me signal and macrophage recognizes it and eats it. There is also one more eat me signal, that is the apoptotic bodies which are released. They are coated with some natural antibodies and complement C1q. Now what is this complement C1q? You will study it in the immunopathology. There is something called as complement system. There all these complements come. So for time being, you just remember complement C1q and natural antibodies are coated to the apoptotic bodies, and that also serves as 8-may signal. So what is the outcome? Rapid clearance. As soon as apoptotic bodies comes out, it has been cleared by the macrophages. There is no inflammation, and obviously if there is no inflammation, then some pro-inflammatory things will also, their production will also be less. So cytokines is one of them, right? So they are also reduced. So this is about the complete mechanism of apoptosis. Now come to the definition. You can understand it very easily. What is the definition? Apoptosis is regulated. Of course, it is regulated. There are some proteins. Energy dependent form of programmed cell death. Obviously, energy is needed, and there is a programming. Like it is like the cell death will happen in this manner itself. So we call it as programmed cell death, in which cells activate intrinsic enzymes that lead to the DNA fragmentation. The intrinsic enzymes, what are the Caspases, right? So that lead to the DNA fragmentation. We spoke it, nuclear fragmentation, and degradation of nuclear and cytoplasmic proteins, cytoskeletons and proteins, that we also discussed, without eliciting an inflammatory response. There is no inflammatory response. It is silent, right? That's all the definition is. And the Greek word, the word apoptosis basically means falling off. The cell falls off. What are the key features of apoptosis? It occurs in a single cell by cell it happens. Cell membrane integrity is maintained. If you see, the cell membrane integrity is maintained, but it is the apoptotic bodies which have been released, they do have the membrane. So cell membrane integrity is maintained, but in the necrosis it was not maintained. All those things will coming out and the inflammation was occurring. So cell breaks into membrane bound apoptotic bodies. That's what I just said, that apoptotic bodies which are released, they also have the membranes. And rapid phagocytosis by macrophages, there is another name for it. It is efferocytosis, which we discussed, and there is no inflammation. So these are the key features of apoptosis. Then write the causes of apoptosis. See, apoptosis happens in both the cases, physiologic and pathologic. So that's why, if you remember, in the long essay we discussed the differences. There we mentioned that necrosis is always pathological, but apoptosis is physiological and sometimes pathological. So physiologic situations, where can we see that? It is essential for the normal growth and tissue homeostasis. So the examples you can see: removal of supranumerary cells during development. Supranumerary cells means during development some organs will have extra cells which is not needed. So all those things are removed. Second thing, cell turnover in proliferating tissues. Proliferating tissues means these cells keeps dividing. So as soon as new cells are forming, you have to remove the old cells. So there also apoptosis is needed. Involution of hormone dependent tissues. What is involution? It is basically regression. Okay, for example, regression of lactating breast after weaning. So a child is born after a few months, obviously the milk production decreases, right? So that is what involution means. And elimination of self-reactive lymphocytes, the lymphocytes which do not respond to the body system, they act on their own, they act their own antigens and all, they will cause some autoimmune disorders like rheumatoid arthritis. So those has to be removed. So apoptosis comes in a picture there. And death of cells that have completed their functions. Right, for example, neutrophils after inflammation. Once inflammation happened, neutrophils did their job. Now they no longer required there, so they have been removed. And disappearance of notochord. All these are physiological situations. Then coming to the pathological conditions, obviously we discussed in the diagram also, that is DNA damage. Now radiation can cause DNA damage. Cytotoxic drugs can cause DNA damage. And apart from that, accumulation of misfolded proteins. In Alzheimer's this happens. We will learn it in upcoming chapters. So there is beta amyloid protein, I guess. So that misfolding protein will result in apoptosis also. And viral infection, that is HIV and hepatitis. And pathology, atrophy after duct obstruction. All these are example for pathologic conditions. Basically causes. Now coming to the morphologic changes in apoptosis, again you can see it in light microscope and electron microscope. In light microscope, cell will be shrinked, intense eosinophilic cytoplasm is present, nuclear chromatin condensation can also be seen, and apoptotic bodies formation you can see. And under electron microscopy, you can even see the chromatin condensation, which will be present at the periphery of the nucleus. And cytoplasmic blebbing. What is blebbing? I have explained it in the long essay also, the video. If you have not seen it, blebbing is basically when a cell, just like how the amoeba has pseudopodia, when the cell undergoes these processes, it also has that kind of structures, but here we call it as bleb. But this is cytoplasmic blebbing, okay? And then fragmentation into membrane-bound bodies, basically apoptotic bodies itself. And biochemical changes, activation of Caspases, DNA cleavage into nucleosomal fragments, protein degradation, and externalization of phosphatidylserine signal. What is phosphatidylserine signal? Eat me signal, which we discussed in the mechanism. So, and one more thing that is remaining here is methods to identify. So identifying apoptosis, when you want to see it, there are few methods like electrophoresis can be done. You can see the broken fragments in a step ladder pattern here. And there is something called as annexin V, which binds to the phosphatidylserine. If it binds to the phosphatidylserine, then you can say apoptosis is positive, because normally it cannot bind because it is present inside now, but in apoptosis it has come outside, so it will bind to it. And there is tunnel assay. So there are various findings you can see and you can determine it. So that's all about the apoptosis, a topic for many of you. I mean, yeah, most of the people are a little bit confused in the mechanism, so I hope this helped. And okay, before you leave, I told you there is a surprise for you, right? All you keep hearing one thing again and again, that is Robbins is too big, Robbins is scary, Robbins is not for exams. And because of that fear, most students never even open Robbins properly. So now here comes the surprise. Everything you studied in this video, every concept, every explanation, it was from Robbins only. Yes, pure Robbins. And look at you now. You understood it, you followed it, you stayed till the end. So, the problem was never Robbins. The problem was the fear created around it. If you see it nice, if you read it, it's actually logical, simple, and beautiful. So, from today, promise me one thing, stop fearing Robbins. Okay? And use it as your base, understand it once properly, and then exams will automatically feel easier. And of course, we are there to make the topic easy for you. So if this video changed the way you look at Robbins, hit that like button so YouTube shows this to more MBBS students, and subscribe because we will break more such fears one topic at a time. See you in the next video. And as usual, keep studying, do well, all the best. Thank you.